directly into my area of expertise.
Subject. Welcome to Tucker Carlson Today. By now, you have almost certainly been told to get a coronavirus vaccine. About 100 million Americans have. You may have. But at the same time, you've also been told not to ask too many questions. Just take it. The questions are always fair. Legitimate questions are worth asking, and in a free country, you have a right to ask them. Our next guest is a strong supporter of the vaccine. He's received the vaccine himself. So is his entire family. But he's not afraid to ask questions about it. And why would he be? He's a physician. He's an immunologist. He's a public health advocate, a retired surgeon. Hooman Norchasm joins us on the set today, and we're very happy to have him. Doctor, thanks so much for coming on.
Thanks very much for having me.
So just let's establish the baseline, your authority to speak on this subject. Why do you know anything about vaccines?
Sure. I'm a physician, as you said.
Yes.
I spent a good 10 years doing a PhD course of studies in cellular immunology. I was trained under the medical scientist training program, which is a grant from the National Institutes of Health for folks who want to do.
Welcome to Tucker Carlson Today. By now, you have almost certainly been told to get a coronavirus vaccine. About 100 million Americans have. You may have. But at the same time, you've also been told not to ask too many questions. Just take it. The questions are always fair. Legitimate questions are worth asking, and in a free country, you have a right to ask them. Our next guest is a strong supporter of the vaccine. He's received the vaccine himself, so is his entire family. But he's not afraid to ask questions about it. And why would he be? He's a physician. He's an immunologist. He's a public health advocate, a retired surgeon. Hooman Norchasm joins us on the set today, and we're very happy to have him. Doctor, thanks so much for coming on.
Thanks very much for having me.
So just let's establish the baseline, your authority to speak on this subject. Why do you know anything about vaccines?
Sure. I'm a physician, as you said.
Yes.
I spent a good 10 years doing a PhD course of studies in cellular immunology. I was trained under the medical scientist training program, which is a grant from the National Institutes of Health for folks who want to do combined degree studies as physician scientists. I was on the faculty at Penn, the research faculty in immunology at Penn, and subsequently at Harvard. I've had NIH funding for about over 10 years. So I feel particularly qualified. I've spent a lot of my time and life thinking about the dynamics of immune cell activation, antibodies, T cells, all the things that basically are involved with how our body responds to infection and to a vaccine. So, when all this started to come up, this tapped directly into my area of expertise.
Give us the overview of the vaccine or vaccines.
Sure. Yeah. I'll start by saying, as you mentioned on the front end of this, Tucker, I've received the vaccine. I received the Moderna vaccine myself, uneventfully. I got the first shot in January, the second shot in February. My parents, who are in their 70s, have received it. My in-laws have received it, all uneventfully. And I've reviewed the data from that was presented to the NIH by Pfizer and by Moderna. These vaccines are very effective at generating neutralizing antibody responses in the form of the antibody we call IgG. They're very effective at priming T cells. And in truth, for folks to know, the SARS-CoV-2 virus is not a very complex virus. It's not like HIV. It's not like herpes. It doesn't permanently integrate itself into our genome, into our DNA. So it's really a transient virus that, our body clears it. We recover from it. That many naturally infected people recover from it quite well. So it's a very simple virus. And simple viruses respond to neutralizing antibodies and prime T cells, which is exactly what this vaccine generates. So when folks in the public health arena talk about the vaccine's efficacy, I think it's a good bet that our science, that this is American science, this is science that we've generated in this country, says to us that neutralizing antibodies and prime T cells can clear this virus out of your body. Now, the question is, have we done enough to make sure it's safe in everyone? Are there categories and subsets of people in whom this vaccine may actually pose some sort of a risk? And I think the answer to that is yes. I think there's no question the data that was presented to the FDA demonstrates efficacy. Right?
Yes.
And efficacy means that if you select a subset of people who are pretty healthy, they don't have pre-existing infections, and you administer this virus to them, they generate IgG responses and prime T cells. And the science will tell us, and I think in practice this is coming to bear, that these folks are protected from the virus. So this is a good thing. This vaccine rather is going to be one of the most powerful and effective vaccines we have made. And in fact, I would say that the fact that we have it is something that every American should be proud of. This is the equivalent of putting a man on Mars in under a year. The technology is robust. It's been around for 30 years. And I think that the Trump administration and Operation Warp Speed did a tremendous job getting this into operation. So I think we should give credit where it's due. This vaccine is going to be very effective. The question that we're here to discuss is safety.
So it's interesting. So you're saying this is a remarkable medicine, and it joins a long list of remarkable medicines that this country has produced over the last 100 years. Not all medicines are appropriate for all people.
That's right.
And so the question is not, does it work? The question is, who should get it? I just want to put on the screen a representative clip. This happens to be from CNN of what I think most of us are hearing day in and day out. Everyone should get this vaccine immediately, and the government should take any appropriate step to force us to do so. Here's a physician on CNN.
If everything is reopened, then what's the carrot going to be? How are we going to incentivize people to actually get the vaccine? So that's why I think the CDC and the Biden administration needs to come out a lot bolder and say, if you're vaccinated, you can do all these things. Here are all these freedoms that you have, because otherwise people are going to go out and enjoy these freedoms anyway.
Okay, so if you don't withhold freedoms from people, they will, and I'm quoting, otherwise go out and enjoy these freedoms without being vaccinated. So that's obviously a kind of authoritarian approach to mass vaccination, but it highlights the attitude, which is the goal, not necessarily health, the goal is vaccination, and everyone should get it. So let's flip it around. Who do you think should pause before getting this vaccine?
Well, that's a really good question. I mean, I think it's a very delicate balancing act, and I have to preface this by saying that a large number of people in our country are susceptible to this virus at this point.
Yes.
This is a pandemic virus, which by definition means that it can infect almost all of us. And somewhere around 0.5% in the overall general population, 0.5% of 320 million people is a lot of people.
0.5%
being the mortality rate,
yes.
right? The overall mortality rate of SARS-CoV-2 is about 0.5%. Now, some people would say, well, that means 99.5% of us are fine. The trouble is that, it's sort of the classic Rawlsian equation in ethics, which is that because you don't know who the next person is who's going to be affected by this virus, that person could be you.
Right.
And so all of us are, in fact, at risk from this virus. So, there's no question that there's benefit to getting the entire population immune, whether you get that through natural immunity or vaccine immunity or a combination thereof. I think that's the goal.
Let me ask you to pause and explain, is one form of immunity preferable to the others? I mean, or do we know that? So you get it, you recover, presumably you're immune, you're vaccinated, presumably you're immune.
Yeah. Tucker, I don't think it's a binary question, because I think my prejudice scientifically is that natural immunity is more robust than vaccine immunity because it's to the whole virus. Now, I can't, in the case of SARS-CoV-2, I can't point to any study that demonstrates that specifically. However, I would say the cost of that immunity is also higher. And the cost is in terms of the mortality cost. So in other words, if we use natural immunity to go down the path of herd immunity, we would have to accept that 0.5% mortality risk in addition to the probably 10% morbidity risk, right? Because there are people who have other complications related to COVID. So the cost is higher. The other cost that's important when we think about natural immunity is the cost in terms of generation of variants, because variants come up when people are naturally infected. So if you're naturally infected, your body is literally generating all these mutations in the virus that could turn into new variants. These new variants are not coming out of thin air. They're coming out of naturally infected people. So the cost of natural immunity is twofold. One is the mortality cost and the morbidity cost of the population. The other is the cost in terms of new variants coming up. Now, if you happen to be naturally infected and are now immune, you're lucky. You're probably very robustly immune. But I don't think that's the therapeutic pathway to herd immunity.
I understand. Therapeutic meaning over a whole population.
Over the whole population. So I think that it's going to be a logical and rational approach to using both natural immunity and vaccine immunity. So in other words, if someone's naturally immune, there's no reason to go in and revaccinate them. And in those persons, it would actually be an unnecessary medical procedure.
Well, wait a second. You're saying, so many millions, we don't know the number, we know it's enormous. Yeah. I mean, we all have relatives. I have a number of relatives who've been infected, and recovered and seem fine. Yeah. You're saying that those people, millions of Americans who've had COVID recovered, should not get the vaccine?
So again, I don't want to say anything that goes directly against the public health narrative, because I know that this is a very contentious issue, and I certainly don't want to undermine the efforts of our public health leaders. But I would say that the vast majority of people who are naturally immune will have quite robust immunity. And in fact, normally, as you know, in other examples, for example, the case of chickenpox, for example, that's one perfect example, is, when you become immune naturally, you are quite robustly immune. So there's no need to go back and revaccinate you. Certainly, if you have IgG antibodies, that is the definition. The standard definition of immunity is the presence of IgG antibodies in your blood, right? So if you go to, let's say, occupational health because you have a new job, right? And they want to know what your vaccine status is, they draw some blood off you and they send off the titers. And if your IgG comes up positive, thumbs up, you're immune, right? I don't know why we're sort of suspending this. Now, in terms of your question.
Wait. So why, I mean, that is kind of the question. Why wouldn't, since we have by definition a limited number of vaccines,
right,
we're prioritizing on the basis of all kinds of criteria. In Vermont, it's now on race.
Yep.
Why wouldn't we say first we're going to screen for everyone who is already immune because of previous infection, and maybe they're not in front of the line? Like, why wouldn't we do that?
Well, that's a very good question. I think that I would like to think that has to do with our public health officials sort of being in a panic mode. I don't want to invoke any sort of conspiracy theory, but I'd like to think that they're maybe in a panic mode and they just want to carte blanche vaccinate everybody, that there's nothing nefarious going on behind the scenes.
What? Wait, hold on. I'm sorry. I majored in Russian history. I know nothing about science.
Yep. And you understand what I'm saying.
Very obvious question to me, and has been for weeks now, months now.
Yep.
And you don't think it's occurred to them?
Well, it certainly occurred to them based on the letters that I've generated to them.
Okay.
So I certainly think that Dr. Woodcock and Dr. Marks, even Dr. Fauci is aware of the fact that we are literally deploying a vaccine en masse in the middle of an outbreak. Now, I want to make sure your audience understands this. This is a very unusual thing. We are literally in the middle of an outbreak where millions of Americans, as you said, are naturally infected or naturally immune, deploying a vaccine that essentially reactivates the immune response. So the question is, number one, is that a necessary medical treatment?
Right.
Number two, is that a dangerous medical approach? And
I think we can settle the first one.
Yeah.
In some cases, anyway, no, it's not a necessary treatment. I think we can kind of say that, can't we?
Yeah, absolutely.
Okay.
Yeah.
The second one is much more ominous.
Correct.
Is it dangerous to give the vaccine to people who've already recovered from the illness?
Or currently have it.
Right.
Because as you know, a lot of people are asymptomatically infected. So that's the question that I sort of, from a safety perspective, I brought to the FDA, as you know. And I wrote several, pretty specific letters to Dr. Woodcock and to Dr. Marks, pointing to this idea that if we indiscriminately vaccinate every American, we will be vaccinating folks who are either asymptomatically infected or have been recently infected. And the problem with that is, Tucker, is that when you have a natural infection, the virus invades your whole body and it leaves its antigenic fingerprint behind. So all the tissues in your body that were infected with the SARS-CoV-2 virus, including your myocardium, which is the heart, the inner lining of your blood vessels, your meninges and nervous system. These are the tissues where the natural virus had replicated in. And even after you clear the virus, for months to years even, these antigens from the virus will persist in your tissues. And now you come in with a vaccine and you force activate that immune response, those tissues will be retargeted. And in fact, this is something that I think we're seeing already. I think that certainly on social media, the signal is tremendously loud. I mean, people who've had prior infections are the ones are having the highest adverse event reports. And certainly data coming out of the UK is showing that the rate of adverse events is about 3 to 4 times higher in people who've been recently infected. Now, we're just ignoring that, right? So we're basically, from a public health narrative perspective, we're saying, let's just carte blanche, vaccinate everybody because we want to get everybody out of trouble, right? Now, we've done this before, of course, right?
I'm just confused. If the reason we're doing this is to reduce harm,
yes,
and there are signs of harm, how can we ignore that?
Well, I think the argument is a utilitarian argument for the public health officials, is that they say the number in harm's way from what we actually know is going to be much larger than the number in harm's way from the vaccine itself. So you're talking about two minority subsets of people. One is 0.5%, one is 0.01%, and we're choosing the larger minority to save. Okay. Meanwhile, for neither minority subset do we know who's going to fall into that category. You could fall into that category when you get a vaccine, and if you've been infected, I could fall into that category if I've been infected and I get the vaccine. We just don't know. So this idea that we're actually sacrificing essentially safety in a smaller minority for the benefit of a larger minority, I think that's the flaw.
But that's all, I mean, that is a consistent theme throughout lots of medical campaigns and all vaccination campaigns that I'm aware of. There's always harm.
That's right.
But we downplay it or ignore it or whatever. We give the makers immunity from lawsuits because we know it's real. What's so striking about this, though, is that you've laid out a very clear, easily explicable criterion for figuring out like who is at an increased risk. And that's people who have it or who have had it. And it seems like it would be a very simple thing to screen for that.
That's right. And so I think the time to have done that, Tucker, would have been at the time when the prospective clinical trials were being done. As I said to you on the front end, these trials were done on the subject groups were folks who were relatively healthy and efficacy was demonstrated. The problem is what was missing from those trials, they weren't really safety trials, they were efficacy trials. So almost entire subsets of the population were missing from the original clinical trials. For example, one subset is pregnant women, right? There were no pregnant women in those subject groups in the original trials.
Why?
Well, because I think the ethics committees probably on the front end would not accept this kind of clinical trial design, right? So it happens, it's almost like it's a passive process where certain subsets of people get eliminated from the subject groups because you can't ethically do something to people who may have a higher complication rate. So you want to do it.
Then how can you ethically give the medicine to people in that same subset?
That's the issue, right? And that's why it takes a long time.
Wait, so they're saying it's unethical to include pregnant women in the trials because it's dangerous to pregnant women, but it's not unethical.
Well, potentially dangerous.
Potentially dangerous. Right. But it's not unethical to give the vaccine to pregnant women when you're not quite sure what the effect is.
Unfortunately, that's the position we're in with this vaccine. And I think it's not a nefarious problem. I think we're up against time, frankly, right? I mean, the pandemic is raging and it's ravaging our country, right? And so I think they've made best decision. But the critical flaw in this particular series of clinical trials, Tucker, is that they're really efficacy trials. So they've demonstrated that this is effective. They haven't done a very good job of assessing safety. And so in this setting, what I'm saying to the folks is, look, to the folks at the FDA, is look, if you haven't done the actual safety trial, you have to use all prognosticated risk factors and mitigate against them, right? So if, for example, we know that there's a reasonable chance that if you vaccinate someone who's recently or currently infected, okay, with the vaccine, you could cause harm, and that data is coming out, then you should mitigate against that. You should work very hard to inform the public. You should put in place mechanisms to mitigate against that potential harm. It's not good enough to say, oh, the majority will benefit, or this minority subset of people who are going to get harmed by natural infection are larger than this smaller minority subset who are going to get harmed by the vaccine. Therefore, it's justified. Look, we've done that experiment in America before, right? You can't sacrifice minority subsets of people for majority benefit. That experiment's been done. The answer is no. We don't do that.
Well, especially when it's not that hard to screen for likely risk factors.
Absolutely. You have to mitigate. And look, when you get in a car, you put on a seatbelt, right? Why do you do that? It's not because you have 100% probability of getting a car accident. It's not even because you know for a fact putting on a seatbelt is going to save your life. You do it because it's a mitigation.
You're playing the odds, right?
You're playing the odds. And so I think that—
Can I just say, this does not shake my faith in the vaccine itself. This is so much crazier and worse than I had any understanding of before the last 20 minutes we've been talking. This shakes my faith completely in the people making these big decisions.
Well, look, I have to say we're in uncharted territory, and I know many of the people who were involved with this process. I know their pedigrees. I know who they are. So I don't look. I think we got to stop this American cannibalism. That's what I call it.
Well, I
right?
agree.
It's like, look, we are in the look, and I'll be blunt with you, okay? China is gleefully taking it to the bank while we just tear each other apart.
I know,
right? And so I think we got to stop that. I think someone like Dr. Woodcock, someone like Munsif Salawi, the gentleman who was in charge of Operation Warp Speed, someone like Fauci, right? These individuals have essentially made their mettle, if you will, in science, in American science. These are Americans. These are people who've actually devoted their lives to science. Now, we can talk about conflicts of interest, et cetera, and I'm not interested in talking about that. But what I'm saying is they delivered an effective vaccine. Now, the safety part of it is what they're making a mistake with. It's a mistake to be vaccinating people who have had recent or current infections. And that's where the public comes in. The public in America, the everyday Americans, I think are far smarter than experts are giving them credit. I think Americans want to enjoy the benefit of this new technology. You know, we want to get back to normal life. People want to get back to business as usual, right? But people have some safety concerns. I think if we actually level with people and treat people decently and explain to them what the vaccine is, and also give them the choice over their bodies, you know? Since when are we taking choice away over your own body? You know, why are we talking about forced vaccinating?
Why is nobody
people?
saying that?
Well, I don't know. That's a good question.
I mean, this is a huge feature
That's a good
of
question.
American political discourse. It's also a huge feature of American medicine.
Yeah.
People have the right. In fact, we've so enshrined that right, the right to control your own body, physical autonomy, right to turn down medical procedures if you like, the requirement that we ask your permission before we do stuff to you.
Right.
It seems all reasonable to me, but that's like at the center of American medicine, is it not?
Tucker, the conduct of a physician in America is bound by the Code of Medical Ethics. The Code of Medical Ethics has 4 pillars in America, okay? One is beneficence, which means you have beneficent intent.
Right.
One is non-maleficence. You don't have any sort of maleficent intent towards the
Right.
patient. One is justice, okay, which you're doing justice to your patient and to the greater whole. And one is the concept of autonomy, patient autonomy. You can't do anything to people by force. You can't mandate someone to get a medical treatment that's either unnecessary or is against their will. And neither 4 of these could override any other one. So you can't say, we're going to benefit the majority, so we're going to override autonomy, okay? Or we're going to override justice because we want to ensure autonomy. You can't do that either. You can't, it goes both ways, right? I think what's happening here is that the public health officials don't have much faith in the average everyday American's understanding and are willing to override patient autonomy for the sake of this concept of utilitarian justice, right? Which means that we're going to save this minority subset of people who are in harm's way from natural infection, but they're not considering that there's another minority subset of people, you know, who are in harm's way from the vaccine or from an unnecessary medical treatment who also deserve to be protected.
So the idea of vaccine passports, which I think we're unlikely to see become a feature of federal law or federal regulation, but much more likely to see become effective when big private sector companies enforce them. You can't fly in airplanes, for example.
Yeah.
Maybe you can't stay in hotels.
Yeah.
Who knows?
Yeah.
That's coercive, obviously. And as for the vaccine as you are, once again, you've taken it yourself. Does a vaccine passport kind of violate the principle of patient autonomy?
Look, I think mandating vaccination does. Let's take some time about this vaccine passport. I think it's going to be a disaster, an absolute disaster. Look, we can't even get our act together to get people to register to vote properly.
Good point.
Let me ask you a question. Who do you think is going to get excluded from this vaccine passport? It's not going to be the nice people in Naples, Florida, or Newtown, PA.
No.
It's going to be the good folks who live in North Philly and West Philly.
Totally true.
It's going to be people in Washington, D.C. and in Deep South and in Western PA who don't have access, don't have the health literacy that it requires, right? It's going to be a disaster for civil rights, for equity.
No,
it's
you're
going to
totally
be a
right.
disaster.
The more disorganized and economically weak you are, the less, I mean, who can even keep, I'm pretty organized and I'm pretty affluent. I can barely keep up with the paperwork of modern American life.
Absolutely. Look, that's the political dimension of it. But I also think that we shouldn't go for this is going to happen, right? I mean, it's driven by massive corporate forces and government forces,
right? That's right.
You know, interacting with each other, and it's going to happen whether or not we like it. But the reality is the same folks who have disadvantages for voting rights are going to have disadvantages for this. So the same folks who are screaming about voting rights and certain populations of people should be screaming about this too, but they're not. That's a political point, right?
But it's such a smart, I don't think it's a partisan point.
It's not a partisan point at all.
You know,
and believe me, people can look up my political inclinations and you'll see it's not a partisan thing. It's a common sense thing, right? But the other point I wanted to make about this vaccine passport, I think we should not call it a vaccine passport. This should be if there is any such thing ever, it should be an immunity passport. So in other words, if you've had a natural infection and you can demonstrate that you have IgG levels in your blood that are protective, or if you've been vaccinated, you should get this thing, whatever this thing is going to be, right? I don't agree with this thing ever coming into existence, but if it's going to come into existence, it should not be a vaccine passport. It should be an immunity passport. So if my brother-in-law or my sister ended up getting COVID, and I can show you that they have 85 to 90 times the level of antibody off baseline, they're immune. Why are we forcing these people to get vaccinated on top of it?
Well, this raises a larger question, which is why the focus on the vaccine and vaccination? The focus, I imagined, of public health would be public health. But instead, getting the vaccine appears to be an end in itself. And I'm not alleging any kind of malintent or conspiracy, but it's very striking and it makes me nervous.
Well,
what's that about?
Look, I think there's conflation going on, right? Because what we're trying to do is we're trying to protect that 0.5% population
right.
who's in harm's way, or 10% who's in the risk of morbidity. We're trying to protect those folks, and the vaccines become synonymous with the protection of those people, and that's become synonymous. So it's almost like this rote one-size-fits-all thing. I was remembering there was a time in American history, in the history of American medicine, where Benjamin Rush, who's one of the founding fathers of American medicine, used to bloodlet. He used to phlebotomize people as a cure for every disease, right?
Does it work?
Well, of course not, right? But one of the things that we've done in American medicine is, as time has gone on, we have become more and more selective and personalized. Everything from the history and physical we do, to the diagnostics we do, to the treatments are personalized. Now here we have this one-size-fits-all therapy that we're given to everyone non-selectively, knowing full well that it's almost a certainty, not almost a certainty, it's a certainty that there are going to be people for whom this vaccine is not appropriate or indicated. And I'm just telling you and your audience and the FDA that the 20 to 30% of Americans who've been naturally infected should not be getting vaccinated, because not only is it an unnecessary practice in those persons, but it's also a potentially dangerous one. It's got to stop. I mean, we can't just cannibalize each other like this. We can't ignore minority harm. We can't violate people's autonomy. We can't mandate a medical procedure for any person, certainly not in a setting where we're doing a one-size-fits-all. That's how harm's born.
Let me ask you a question I should have asked at the outset, which is, how exactly, for our viewers who don't know, how do we measure the harm from a vaccine? How do we know who's been hurt? Mm-hmm. And what do we know about the rate of injury right now?
Yeah, Tucker, I had a professor in medical school who said that the eyes do not see what the mind does not know. Or it's a sort of a different way of saying you ain't going to find what you don't look for.
Yeah.
Okay. And so our surveillance systems are too passive. And look, if J. Barton Williams of Memphis, Tennessee, who was a 36-year-old orthopedic surgeon who'd had an asymptomatic infection, got vaccinated and burned up and died, if we're calling that true and unrelated, that's not related to the vaccine. Or if Cassidy Curell of Utah, perfectly healthy, 30-some-year-old single mother, operating room nurse, gets the vaccine and dies, true and unrelated. If Marvin Hagler ends up getting the vaccine 2 days later, has a heart attack, true and unrelated. If Hank Aaron gets the vaccine 2 days later, strokes out, true and unrelated. The list goes on, right? We're not looking. If we don't look, we won't see.
So, but why is it the instant reaction of the gatekeepers of American life to shout you down? Well, I suppose, given your credentials, you can't be shouted down. But if I were to say that about Hank Aaron, and I have no earthly idea why Hank Aaron died, he was an elderly man.
Look, I don't know either for a fact. I'm just saying we got to look.
But asking the question doesn't seem out of bounds if you care about people's health, right? Why are people shouted down when they raise that question?
It's because I don't think the leaders of our country have faith in everyday Americans. People think this is going to stoke vaccine hesitancy, right? So I say, you know what? We should make sure that after this vaccine, people don't stroke out or have MIs. Suddenly it's like, you're going to cause vaccine hesitancy. Shh, don't talk about it, right? Well, that's not how it works.
What's counterproductive scares the hell out of people. I don't know what's going on with the vaccine. Right. I have no grounding in science. I know bullshit when I see it, and I can tell when someone's lying. Right. I can just tell. That's what I do.
Right.
And I know they're lying, and it makes me paranoid.
You know what the other aspect of this thing is America really has an opportunity to save the rest of the world. I mean, the reality is the world does not have the vaccine, right? So look, we're going to pop 2 vaccines into 320 million Americans, right? What's that? That's 640 million vaccine shots, right? These are shots that we can actually share with our neighbors and with the rest of the world to protect them too, right? Because the more people get naturally infected, the more virulent this virus can potentially get because new variants come up, right? And so the idea that we would unnecessarily vaccinate Americans who either A, don't want it or are immune already because they've had it. And let me tell you, the Red Cross just did an analysis of all the blood donors. About 20% of Americans are already naturally immune. The number is probably about 20 to 30%. 1 out of 3 Americans are already naturally immune. So we're giving these folks the vaccines that we should probably be sharing with our partners and allies all over the world so we can all get out of trouble, right? Instead, what are we doing? Instead, we're force vaccinating. We're trying to compromise civil liberties. Okay, we're going to create discriminatory practices in terms of vaccine passports. We're going to have college kids, 30 to 40% of whom are already infected, right? Vaccinated, some of them potentially getting harmed from it. Why? Because we're just sort of on this train, on this locomotive going at Mach speed and don't want to slow down.
Really, it's true craziness. I want to revisit a question that I got sidetracked and interrupted your answer.
No
so I asked, how many people are getting hurt? How do we know that? You said we're not really looking and it's hard to know. Is there a place where we can get real numbers? Do we have any actual indication that you're satisfied with is accurate?
That's the biggest criticism of my perspective is that where's the evidence, right? And my answer to that is, number one, this pandemic is about a year old, and it takes time to collect evidence. And if you're not looking for evidence, you're not going to collect the evidence, right?
Right.
So I think the evidence is sparse, but a study did come out a couple of weeks ago out of Manchester, UK, which shows that the incidence of adverse events is about 3 to 4 times higher in folks who've been infected in the past. And so what that's saying is that the bell-shaped curve of adverse events is shifted to the right in the recently infected folks. That means wherever Death Valley is, okay, wherever the dotted line is where deaths happen on the adverse events curve, the tail of that bell-shaped curve is in Death Valley, right?
Right.
And that's just a prognostication. Now, my critics could come
I'm sorry, can you just flesh it out for our viewers who don't follow the metaphor? What you're saying is a certain number of people that die, but that suggests a much larger number get hurt.
A lot more people are getting hurt, and some on the tail end of that curve will die. So if you're a 70-year-old, 70 is not that old these days, but let's say you're an 80-year-old in a nursing home and you have all kinds of comorbidities and you're frail, and you've had an asymptomatic infection or you just cleared a natural infection, the vaccine comes along, reactivates your immune system, and you get naturally, like hyperinflamed again, and we're calling that COVID, right? Meanwhile, it's not really COVID, it's a vaccine reaction to the vaccine in a recently infected person.
So that person wouldn't have been sick again if he hadn't gotten the vaccine.
Correct.
So we're hurting people, is what you're saying. That's what you're describing.
That's my prognostication. My prognostication is that if you put the vaccine in folks who have been recently infected, you stand a chance of harming them. And that is actually a very specific scientific prognostication, right? So in other words, the science of immunology, the basics of cellular immunity tell us that if you force activate T cells using a vaccine, those T cells will home into the tissues where the virus was and the viral antigens persist and cause inflammation. Now, if you're 24 years old, you'll survive that, right? But if you're 79 years old and you have, atherosclerosis and all kinds of other problems, you'll die. You'll get a fever of 103 and you'll have a lot of body pains and aches, and 2 days later you're dead. Or if if you have some vascular damage, you'll end up stroking out or having an MI, right? And we're calling that
MI being a heart attack.
A heart attack, right? And you're calling that true and unrelated. You just can't do that. Look, this has happened before.
May I ask you a question? And this is it.
Sorry,
I'll tell you where it comes from. No.
I don't mean to go on these
conversation. No, I love it, and you're a great explainer of it. I'm the test market. I'm coming at this pretty cold. So if you can explain it to me, I think our viewers are following along for sure. Following scenario, you tell me what you think. 77-year-old man, pretty vigorous health, gets his second shot, 2 days later dies of a heart attack while exercising. Physicians say we don't believe there's any medical chance that this heart attack was related to the vaccination.
That may very well be true.
Do you think it's fair for the physician to say there's no possible connection?
No, And that's the mistake. Yeah, in this scenario, you want to look, in medicine, we err on the side of caution, of protecting the people who could actually be harmed. See, when I was doing my residency, one of my mentors used to always emphasize, you're not judged by the 99% of patients who do well under your care. Right. You're judged by that 1% who don't do well, right? And so if you start with the assumption that, oh yeah, he had a heart attack, it's true and unrelated, you just assume that, right? Then what you're doing is you're ignoring the fact that some of the science is prognosticating that this could be a problem,
right?
And you're ignoring it in a setting where we're actually doing this to millions of Americans.
Right, on a mass scale.
Mass scale.
By the way, I can't, since you are a doctor and you would know the answer, when Hank Aaron died, again, at an advanced age, and there was this controversy over how he died, and some prominent persons just perhaps there's a connection to the vaccine. And the pushback from a bunch of different people in authority was, no, he died of, quote, natural causes.
Yeah, my understanding is he died of a stroke.
What are natural causes? I've read that all my life in the newspaper. What is that? Is that a term you learn in medical school? Natural causes?
Well, it's non-specific, and I think it's a narrative that's being sort of I think this fear again is that this would cause vaccine hesitancy. And again, I think
so that's not a medical term, though. That's not a real explanation.
No, it's basically hand waving, right? It's like, oh, yeah. It's abracadabra, it's nothing, right? Or it's true and unrelated, right? That's what it is. But I think fundamentally where it comes from is a certain level of hubris when it comes to actually explaining to people, hey, look, we don't know. We're in unprecedented territory, right? But we really have an opportunity to use our science. This mRNA vaccine didn't come out of thin air. Tucker, this mRNA technology has been in the making for 30 years by some really smart Americans. We have an opportunity to not only save ourselves, but save the world with this damn thing, right? The reason why the mRNA was selected by the Trump administration, Operation Warp Speed, is because mRNA is scalable quickly, right? You can make mRNA, we can make a ton of mRNA in record time. And that's the reason why they picked it. Because they wanted to save America and the world, right? It wasn't a random pick, nor was it based on, it's not gene therapy. It's not like, oh, some mind control device from Bill Gates. It's not that. It's American science.
So why do people think that it is? I mean, there's something about RNA, about this particular technology that makes people nervous.
Well, I'll tell you why it is. It's unfamiliar, okay? But you and I talked before the show. Look, the internet technology existed for decades before the internet came into the marketplace, right? Cell phone technology existed for decades before it came into the market, right? This mRNA technology has existed for 3 decades inside of pipelines, right? Of universities, academia, and industry. Why didn't it come out? It didn't come out. It wasn't coming out because established industry was sort of holding it back. All the money interests that go into the standard vaccine development, there was no incentive for it to come out. The incentive was introduced by Operation Warp Speed. Some really smart people at Operation Warp Speed talked to the administration and proposed a speedy way to a solution. Okay. And listen, love him or hate him. Okay. President Trump was a risk taker. And and again, folks can go ahead and look up my political inclinations. I have a lot of criticism, but I think he was a risk taker. I think they put it in front of him and he pulled the trigger on something unprecedented. I mean, this thing is the same as putting a man on Mars. But that does not obviate us from the duty to protect people who are in harm's way.
Of course not.